Mr. Hite is a 28-year-old male coming in for a routine dental visit. Let's go get him from the waiting room. Mr. Hite,
Yeah, that's me.
come on back. Have a seat, please. So what brings you in today?
Just here to get a cleaning. Haven't been to the dentist in a couple years, and I thought it'd be a good time to come in, just check things out. I guess that's what they say I should do. So.
Okay, well, if you
Yeah.
haven't been in a couple years, I'm so glad you're here. Can you tell me a little bit about your oral habits?
Yeah, I don't think much about it, but I guess I brush. I brush about a couple times a day, and I use the water floss
Oh, yeah.
thing a few times a week, but not all the time.
Okay,
I just, yeah.
that's good. We can work with that. To better understand how the plaque on your teeth can stick in the little nooks and crannies, I'd like to do something called a plaque-free score. It's where I'll apply some purple dye to your teeth, and it'll show us which areas you might be missing when you brush and floss. Does that sound okay? It'll wash off in a couple hours.
That's fine.
All right, I'm gonna lean you back and have you put on some safety glasses, and then we will get started.
Okay.
These on, please. And now, keep your mouth open for me, please. I'm gonna apply the purple dye. And I should have put on this non-petroleum gel on your lips to keep them from turning purple. You don't have any restorations according to your chart and your x-rays, so we don't need to worry about those. There we go. All right, I'm gonna go ahead and rinse you out. Is that okay?
Uh-huh.
A little bit of water. Okay, you can spit into
Thanks.
Okay. All right, so let's see how you did. Let me get you a mirror. Can you look in there for me? All right, so it looks like we're leaving some plaque on the interproximal areas. That's between the teeth. Maybe from flossing. Otherwise, it looks pretty good. Yeah, you see those purple areas?
Yeah.
The pink areas are newer plaque, so we're not as concerned about those. Now these darker areas are the plaque that's been there for a long time, and if those aren't handled, they can cause cavities and disease.
Okay.
So, with all that being said, how do you think you did on this plaque-free score?
Not very good, but it is kind of cool to see like the areas I haven't been brushing as much.
Yeah, well, it looks like you got a 45% on this. This was just a pop quiz, so that's not bad. How do you think you can improve your score for next time?
I'm not sure exactly, but I want to try to get it up to like a 75%. You have any suggestions on how I could do that?
Why, yes, in fact, I do. And 75% is a great goal. With some new oral habits, I know you can do it. But first, let's talk about why we're getting plaque off your teeth. Do you have any thoughts?
Because the plaque causes the cavities, right? The buildup?
Yep, that's a big part of it. It can also cause diseases like gingivitis and periodontitis. When the plaque stays on the teeth for a long time, it hardens into something called calculus, which allows germs to fester and irritate your gums. This can lead to pain, bone loss, and even tooth loss.
Oh, wow, I didn't know that. How can I like stop getting all these things like these diseases and itis stuff in my teeth?
Let me show you. All right, so based on your dental needs from our plaque-free score and the assessment, I would recommend this manual toothbrush right here. It has
Okay.
soft bristles or filaments, and they're angled and round, so it'll be nice and gentle on your gums.
Okay.
Can you show me how you brush?
Oh, yeah. Toothpaste, water.
Okay.
Like that.
All right, we can work on that.
Was that bad?
No. I'm just going to show you how to do a different method that will get all the surfaces of your teeth so that we can get off all the plaque that you've been missing, okay?
Sounds great to me.
Okay, so the method I'm going to show you is called the modified Bass method, and that includes the occlusal method as well, so I can get all the surfaces of your teeth.
Okay.
So I'm going to show you on my little friend here first how to do it, and then I'll let you try. Does that sound good?
Sure, that sounds good.
Okay, so first you're going to angle your brush up towards the gums, and you're going to just kind of vibrate there for about 10 seconds, and then the modified part is when you roll down. So vibrate and roll, and that gets all the gunk out of your teeth and your gums. And then the occlusal brushing is where you're going to get all the biting surfaces to get the food out. So you'll just go right along there like that. Think you can try it?
Yeah, I'll try it. Thanks.
And you'll want to brush for about 4 minutes with this toothbrush twice a day. Doing your best to brush each surface of every tooth. Okay, can you show me the rolling stroke?
Up there.
And roll out. There we go. Awesome. That was great. Now I know you said you use a water pick a couple times a week, but I'd like to show you how to floss with regular dental floss since your plaque seems to be getting stuck in between your teeth. How do you feel about regular floss?
It's okay. Every time I try, my gums bleed. But you should probably show me how to do it because I don't know if I'm doing it right, honestly.
All right, so what you're going to want to do is pull out about an arm's length of floss, just like this. And you'll want 2 pieces, one for the top and one for the bottom. Okay, and then you're going to wrap a little bit of the floss around one finger and the rest of the floss around your other hand, like this. See?
Yeah.
And then, let me show you on our buddy. You're going to go in between the teeth, right like this. And you make a C after you wiggle in. So if it's tight, you just need to wiggle, 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 and then make a C and go up and down like a shoe shine on the teeth. And then you'll go to the other side and wiggle through and make a C, go up and down, just like that. And that'll get all the plaque and germs out from in between your teeth and up at your gum line. Does that sound like something you can try?
Yeah. When can I try it?
Right now.
Really?
Yes. There you go.
Thank you. So a couple times. And make the C, right?
Yep, make the C and just be careful not to snap it up in there. You want to wiggle, wiggle, wiggle until it gets past the tight part. Looks good. And you want to make sure you get a new piece of floss in between each tooth. Yeah, there you go. There we go. Perfect. All right, that was awesome. I want you to try to floss once a day before brushing so that the toothpaste can get into all those areas while you're brushing. And speaking of toothpaste, how do you feel about trying a new one?
I'm open to it.
Okay,
Yeah.
awesome. Well, I would like you to try this one called Parodontax. It's meant to help prevent bleeding gums, since you said that yours tend to bleed when you brush and floss. Is that okay?
Will that help with my bad breath too?
I'm so glad you brought that up. Oftentimes bad breath is caused by bacteria that get stuck on the tongue. So I want to show you tongue cleaners. Do you know anything about them?
I've never heard of them, really.
Okay, let me show you. So they're just these little things right here. These are disposable, but they also make reusable ones. You're going to open your mouth. And you can do this before or after brushing. And you're just going to go to the back, scrape it forward. Go to the back, scrape it forward. And you'll see all that gunk come off on here. You can rinse it off and then just throw this one away, or rinse off a reusable one. Okay, now you try.
Thank you. So all the way in the back?
Mm-hmm. Mm-hmm. Good, good. All right.
That feels good, actually. I didn't know my tongue could cause bad breath like that.
Yeah, it sure can. I'm gonna put a couple of these disposable ones into your goodie bag, and along with your toothpaste,
Okay.
your toothbrush, and a floss.
Great, thank you.
All right, so for next time, what is your new goal for your plaque-free score?
I definitely think I can get to a 75% or better.
That's right. And how are you going to do that?
Pretty much the stuff you taught me today. I mean, brushing with the new toothpaste, doing the modified bass method, I think you said it was called, sea bass, and then doing the flossing with the string, the C, before brushing my teeth.
Yeah, you got it. I can't wait to see your progress in 6 months at your next checkup. All right, so first I'm going to dry your teeth. Can you open?
That's toxic.
Okay, nice and dry.